My name is Jonathan Somerville, and I am a family physician working in Sundre, Alberta. I've been working there for about 5 years now, and ever since I started working out there, I have been involved with teaching medical students and residents, and I have found that this is a very enjoyable part of my practice. I'd like to thank you for your willingness to become involved in medical education as a rural preceptor. There are a lot of unique experiences that students can have in a rural setting. Rural medical rotations offer learners the opportunity to see an incredibly wide range of medical problems and undifferentiated pathology. Every day in a rural or remote teaching environment, learners will see an incredible volume of patients. This gives students opportunities to develop independence that is unrivaled in most other teaching settings. They will have call shifts where they may be able to work independently overnight. They could be first assist in the OR. A number of different opportunities are available. Students will actually have the opportunity to learn about their patients and get to know them as they see them over a number of different visits and even across several settings. They'll also get the opportunity to see highly skilled teams working in collaboration every day. They will see nurses working alongside of paramedics and hospital administrators working alongside of facility maintenance. This will give learners a chance to give back to the community and really enhance patient care. Rourke and Rourke have a chapter on teaching in a rural and remote setting in the book A Practical Guide for Medical Teachers. In this chapter, they list 6 attributes that they adapted from Mannion et al. Of preceptors who are scored highly by medical students. Effective preceptors welcome learners as legitimate participants in a community practice. They create a central role for learners in patient care and teaching. They regularly engage learners in self-reflection to monitor their progress. They help learners discover learning opportunities in routine patient encounters. They use their feedback to shape rather than evaluate learner performance, and they create an environment where learners feel comfortable practicing new skills with patients. Here are the objectives of this video. I'd like to go over a few key principles to help you set up your rural teaching practice for success. We'll cover the areas of orienting the learner to multiple environments, collaboration and communication, how to create team players out of your learners, direct observation and feedback, developing medical experts, learners in difficulty, how to encourage resiliency and get engagement, professional and personal development, and then making it work in practice. One of the first steps in setting up for success in your practice is to orient the learner to all the environments that she or he will be working in. If you orient your learner to all the facilities that you work in, when you get an unexpected call about a resident in long-term care that needs an assessment, you'll be able to send your student over confidently to begin seeing and managing the patient. This will really help to legitimize the learner in their role in the team. By making them responsible for patient care at all times, they will feel engaged from day one. A rural environment can be a tight-knit community with many of the staff having worked together for years or even decades. The sooner that learners are introduced to the team members, the faster that they will begin to engage and feel comfortable performing patient care. After your learners arrive, it's important to discuss the course learning objectives and to agree on a plan about what you would like the learner to develop during his or her time there. Help them to develop some personal goals and objectives that they would like to accomplish on their rotation. This can include time-setting goals, how they manage their time across the multiple settings of clinic, hospital, ER, and long-term care. Determining where they are at in developing a focused history and physical exam. This may vary if you are dealing with a medical student on one of their first rotations, or if this is a resident who is just about ready to begin practice. It's important to go over charting and expectations for charting. In a rural setting, the student will be working with the office EMR, hospital records, charting in the emergency department, long-term care, and they need to have an adequate approach for each environment. They will often need some coaching in how to develop and implement their plans. Learners will usually have a logbook to keep track of their clinical experiences. It's important that you review this with the learner periodically to make sure that they're seeing what they want to see and making sure that any gaps are addressed early on in the rotation. It's really important to help learners find their place in the medical environment that you are working in. This is key for effective collaboration. If you want to have students functioning as part of the team, they need to know their roles and others' roles right from day one. Take the time to make sure that your learners are properly oriented to all the environments that you'll be working in. For example, they need to know how to put orders in your hospital system. They will need to know where to find charts in the long-term care. We want learners to engage as team players right from day one and to jump into patient care at the full scope of their learning level. Many physicians will do some sim experiences with their new learners in order to incorporate them into the learning environment. One thing that may be a unique opportunity in a rural setting is to have telehealth roles in your sims, where students can call up someone for advice who may actually look in at the scenario with a camera and directly guide the student in terms of how to place an endotracheal tube, what type of infusion to begin, and so on. This is an experience that they probably won't have in any other setting. In order to really maximize independent learning, direct observation is required. The key is to do it early in the rotation and early every day. Early observation allows learners to function at the appropriate level. It is easy to underestimate or overestimate learners' capabilities. A third-year medical student could be at the beginning or at the end of their rotation, and they may have had vastly different experiences. It's important to determine what they have seen and what they haven't seen and what they can do competently. Learners may also display varying levels of confidence, which may or may not be congruent with their actual competence. Direct observation should be done on a daily basis, and it's usually easier to do it early in the day before time constraints become prohibitive. Consider scheduling patients that will provide good learning cases, and if possible, give quick feedback immediately after observation. This allows the learner to put your advice into practice during the remainder of the day. Gauging competence leads to the development of clinical courage. This is another great feature of rural environments. Every day we have cases and scenarios that really push us to the end of comfort and make us function at the edge of our clinical competence. You'll have the opportunity to coach your learners and to help them to know how to get through these difficult cases. This will help them to feel comfortable being a little bit uncomfortable when they start their own practice. In every rotation, students have a lot of anxiety and are under a lot of stress. In a general rural family medicine rotation, there may be a lot of anxiety about the content that will be coming up on their exams. Because what comes through the door is very unpredictable, students often have the fear that they won't see the right case presentations that they'll need to pass their exams. Help the learner by acknowledging their anxiety and pointing out that there are a lot of important learning opportunities from every single case that they see. Give them direction by highlighting the general principles that you use for problem solving on a day-to-day basis. Suggest some reading topics that are broadly relevant so that they don't spend too much time focusing on highly specific details of rare presentations that they may have seen during one day of their rotation. Medical students and residents face a lot of challenges through their entire rotations. However, in a rural or remote learning environment, learners will be away from their family and friends and a lot of their traditional supports during their rotation. This can really become exacting, especially in longer rotations. For some students, this may have the effect of actually aggravating the stress of an already stressful medical education beyond what they're able to handle. Make sure that when issues arrive, they are addressed in a timely fashion. Arrange appropriate medical care and counseling if needed. It may be helpful to involve your colleagues who are not directly responsible for their learner's education so that you don't get in the trap of having to become the learner's medical doctor or counselor. Medical students or residents will often be working with the same preceptor during their entire rotation. This could lead to conflict if there is some problem with personalities. Students who are from a visible minority or another cultural background may feel very ostracized in a rural environment where they don't have a lot of their traditional supports. Rourke and Rourke suggest pairing students at rural locations to help mitigate some of these conflicts. If there's a problem with one preceptor, preceptors could switch students. Having students come out in pairs increases their collegiality and helps to mitigate some of the social isolation. Professional and personal development. This isn't something that you need to hear a lot about from me, but it's important that you bring this up with your students. This may be the first time where they're working in an environment where they may see their patients at the grocery store. Take the time to explain how you've developed personal and professional boundaries so that you can work in the community and continue to live there. During an extended rotation, you may develop a strong relationship with your students. It's important that you avoid the trap of becoming their physician or counselor if they run into problems. Make sure that you involve your colleagues when your learners need medical or psychological advice. There are a few things that you can do before the learner arrives to make sure that your practice is ready for students. It's important to have examination rooms that allow observations. You need to have a study room for the student where they can work quietly to do their charting and look up cases. It's also important that they have a place for their belongings in all the environments that they're going to work in. Make sure that you have clear communication with the university. Know who your program support contacts are. Let your colleagues know that you'll have students working with you. They may have an area of focused interest and could have the students spend a day or two with them to broaden the diversity of their experience. In a busy rural practice, it's important to take some time to set up your schedule to make sure that your days run smoothly and you have time to spend with the students. You might be able to offload some of the orientation details to administrative staff in your office. Staff members could be trained to help the students become familiar with your EMR. Staff members could also contact residents ahead of time to determine what type of scheduling preferences they have. For example, how many patients they will see per hour, what time off they may require, and making sure that their accommodations in the rural setting are working out. Your office staff can also be trained to select the appropriate type of patients for your learners. For example, your staff probably know which patients are going to be receptive to learners, or which patients have common or rare illnesses that it's important for the learners to see. Now that we've gone through this video, I hope that you will really feel comfortable to welcome students in your practice. Remember that the rural experience is one of the most unique rotations that the student will have. They will be able to develop a new level of independence and confidence that they haven't previously had. It's important that they're engaged from day one. Building a strong relationship with yourself as their preceptor and all the other members of the medical team will really help them to be engaged and feel legitimized in what they're doing. Help them to see that they have the opportunity to give back to the community and really offer something to the patients.